We'll probably have just a limited amount of time, so maybe one more question. Matthew.
Thanks a lot. Matthew Lee, Inner City Press. I remember, yeah, hi. There had been, I mean, obviously, it seems like the root of some of this is the overprescription of antibiotics. And so I know in a previous meeting here, there was some discussion of what exactly the international system can do if doctors are regulated locally and it's sort of up to them. Is there any moves, or do you anticipate this panel, working on trying to either have some sort of more than local regulation of doctors and their prescription practices? And on the budget, question, one of the things people have noted in the announcement is like PEPFAR, various health programs are some of the few programs that seem to be at least initially escaping the scalpel. Do you expect, does WHO on its own, do you expect to engage in terms of health programs with the Trump administration? Is it going to be a system-wide response? Is it sort of every agency for itself? This might fall to the DSG. Overall, what's the plan? Thanks.
Let me talk about the issue of overprescription. It is a fact that I think this is, again, oftentimes it is driven by doctors, particularly doctors who prescribe and also sell antibiotics in their clinic. There is an incentive to do so. So we provide technical advice to governments. It would be good for governments to put in place regulation and gradually transition to separation of prescribing and sale. And of course, we also need to look at the demand from patients is also a big driver. Many patients suffering from viral infection would not leave the doctor's surgery without a prescription of antibiotics. So I think education, awareness is important to all partners involved. And yes, the health sector must play its role, and as well as the agricultural sector. And we support the use of antibiotics for sick people and for sick animals. That's important. But having said that, we would advise that antibiotics should be used under the proper guidance of trained doctors in the human health and trained veterinarian in the animal sector to make sure that we reduce the risk of mutation of microbes arising from misuse and overuse. And all the points you said are very good. Now, of course, I did not have time to look into the details of the impact of the budget presented by President Trump. Clearly, we will work as a UN family to see, in what way we can engage with the US government and to really advocate and share with them the great contribution they have made to global health and how they can continue within a budget cut sort of environment. Every government is cutting budget, and it is not new. But we can find ways and means to be efficient, lean, and deliver on the results. I say this because I've been in UN for, 13 years and 10 months by the time I finish. I think UN is very important for many countries. We need multilateralism. There are issues that no individual government can solve. And that's why it is important we use the multilateral system to find solutions that require a multilateral response. And I'm sure, the leaders in the US government understand this.
Yeah. Let me just say very quickly, adding to what Dr. Chan has said about the use of antibiotics, that the level of self-medication is very, very high in developing countries. And again, this is seen to cut costs because having access to hospitals and professional staff is a luxury for many. And so education is going to have to be a big part of this, and making sure that we find innovative ways of getting people access to healthcare so they don't have to self-medicate, particularly on antibiotics. With respect to the budget, I think the SG has been very clear about his response. And this is a budget process that is very complex. It is going to take time. It will signal where those cuts start to come, and then we will engage as a system. And I think it's very important that we continue to take the lead of the SG on that. Continuing to first appreciate that the United States is the largest contributor, continues to be, and the reasons why it should continue to be, why it should maintain that leadership. That there is much of this is not just about funds for peacekeeping, it's also about funds for the whole prevention and sustaining piece of this. We know all member states signed on to the development agenda. It is a broader approach to ensuring that we spend less on conflicts, and that we try to ensure that we are more efficient in doing so, that we bring not just from headquarters but at the country level better efficiencies to do the job. So I think this is an engagement that is important, and we will continue to do that, but continue to stress the importance of more rather than less, making us more efficient, and having more funds, because we're doing a whole of the development agenda. We're not doing a piece of it. And we're acknowledging that public funding is important, but we're also saying there's a lot of other funding around there as well that needs to be leveraged. And so therefore, leadership is important at this particular stage. And as I think Dr. Chan said, absolutely, we are better together going forward. It is what multilateralism is about. And we need to continue to underscore how it's needed even more today than it ever has been.